I think that appropriateness of care is one of those topics that we've not had the conversation about. It's a societal conversation. I think we need to have it outside the walls of hospitals and healthcare facilities as well as inside, as we talk to patients and to our public about the kinds of services that are being provided.
It looks as if things are going to carry on getting harder, and I think if we carry on doing things without thinking about whether they're going to be beneficial to patients or not, the system is just going to drown under the weight of our habit. And so we've got to stop and examine everything we do and say, is this better for the patient? Is it better for the patient who's waiting for that spot? And is it better for society?
Appropriateness of care is about quality of care. And I think all physicians are interested in providing the best quality care to their patients as they can. And appropriateness is a very important aspect of quality.
I think when if someone asked me about why appropriateness of care would be important in the face of difficulties in the system today, I think my question back to the patient would be, what does that mean to you? When you say the issues facing healthcare, do you mean resources? Do you mean access? Do you mean wait times? Because I see appropriateness of care of helping us in those realms. If you ensure what you're doing for your patient is the right thing, and if that means not ordering that particular test, or not doing that particular procedure, or not doing that particular x-ray, it means they're not on that wait list, and those that actually need the care are going to get it in a more timely, appropriate fashion.
Everybody wants what they need and no more. And sometimes we don't understand that because we live in a society where people want more and more and more. We're pretty greedy. And more healthcare means more medication, more costs, more side effects from tests, more everything, and that's not really what any of us should be wanting. We should be wanting exactly what we need. The cost savings from not doing all those things and causing side effects and causing falls from putting people on sleeping pills and all kinds of other things that are not necessary and are actually harmful. The cost savings from that will benefit the system and allow us to, for the same money, have a better system.
Appropriateness of care is important for all physicians to be aware of because we need to individualize treatment for our patients. And we have lots of guidelines from all kinds of different societies and professional organizations for our whole host of different diseases. And now there's the national campaign of Choosing Wisely, which kind of correlates those together. And in a certain few instances can kind of give us some direction. But that still kind of is a broad stroke looking at all populations, whereas appropriateness of care, we can really tailor our attention and our treatments and investigations for the specific patient that we're in front of at that time.
Any profession that is guided by critical and discerning thought is stronger than one that is not. Medicine has a long history of scholarly endeavor. The whole concept of evidence-based medicine over the last 20 or 30 years has really got us to focus on doing things that the evidence supports, that the evidence suggests are good. We have this patient safety movement where we focus on not doing anything that could possibly hurt the patients or trying our best not to hurt patients by our attempts to help them. Choosing Wisely is just another step on the same road. It's trying to get closest to the truth, and the truth is, how can I help my patients as much as I possibly can, and how can I hurt my patients as little as I possibly can.